everyone, I am Lourdes Jane Herdistar Renoblas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for vital sign taking, which includes taking the patient's respiration rate. Vital signs are defined as the clinical measurements that indicate the state of a patient's essential body functions, whereas respiration is defined as the act of breathing. The purpose and significance of counting respirations is 1. To monitor abnormal respirations and respiratory patterns and identify changes. 2. To monitor respirations before or after the administration of a general anesthetic or any medication that influences respirations. And 3. To monitor clients at risk for respiratory alterations. First is to introduce yourself to the client and verify the client's identity. Mayong adlaw, ma'am. Ako di ay si Jane, imong student nurse. Pwede ko mangutana, unsa ganito'y pangalan ni mo, ma'am?
Mayong adlaw, nurse. Ako si Solel Riego.
Salamat, Ma'am Solel. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to explain what you are going to do and why it is necessary. Ma'am Solel, karon magkuha ta sa imuhang respiration rate. Ato ani siyang pagkabuhaton. Una, para ma-determinar kung aduna ba'y mga dili maayong pagbag-o sa respiratoryo. Ikaduha, aron ma-monitor nato imong paginhawa sa wala pa o pagkahuman sa paghatag sa usa ka general anesthetic or bisan unsa nga tambal nga makapa-impluwensya sa imong paginhawa. O ikatulo, aron ma-determinar nato ang mga pag-assess sa mga pasyente ilabi na kadtong mga peligro sa mga naay pagbag-o sa respiratoryo. Nakasabot ra ba, ma'am?
Nakasabot ra, nurse.
Salamat, Ma'am Solel. Providing information to your client will minimize fear and anxiety, will foster trust, and will promote cooperation. Next is to wash your hands or perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of health care. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to place the client's arm across the chest and observe chest movements while supposedly taking the radial pulse. A client who is aware that the nurse is performing the procedure pronto may not breathe naturally. Next is to start counting by watching the second hand of the watch and count, starting with inspiration and count for a full minute. A full respiration consists of one inspiration and one expiration. Next is to observe character of respirations, which includes the depth of respirations by the degree of chest pull, whether it's shallow, normal, or deep, and the rhythm of cycle, whether it's regular or interrupted, and the sound they produce and the effort they require. This will allow the nurse to assess for any irregularities or abnormalities which may require the nurse to have a more careful assessment. And lastly, record, rate, and character of respirations in the patient record. Documentation provides coordination of care and facilitates ongoing data collection. A well-written and detailed record of the client will serve as a foundation for an efficient nursing intervention. Lastly, wash your hands to prevent nosocomial infection.